Every morning, millions of older adults do something that seems completely normal, but it can quietly become the trigger for sudden death. And the most unsettling part is this. I'm not talking about smoking. I'm not talking about eating greasy food. I'm not talking about a stressful argument. I'm talking about something you probably did this morning before you even brushed your teeth. My name is Dr. Adrian Cole. I focus on health and wellness education. And after working closely with older adults for many years, I have seen a pattern that repeats itself again and again. People who seemed perfectly stable, people who had no serious pain, people who felt fine. And then something happened in the morning between 6 and 10 a.m. That time window is not a coincidence. It is the most dangerous time of day for your heart after the age of 60. International heart research agrees on something very few people know. The risk of sudden cardiac death can triple in the first hours after waking up. And here is the most important part. It is not just the time of day. It is what you do during that time. Because when you wake up, your body goes through an extremely delicate biological transition. Your blood pressure begins to rise quickly. Your heart rate increases. Your brain releases cortisol and adrenaline. Your blood vessels tighten slightly. All of this is part of your body's natural wake-up process. But when you add a sudden movement, a sharp action, an immediate physical effort, right in the middle of that hormonal activation, the heart can go into sudden overload. And in an aging heart, that can be enough. Sudden cardiac death does not always come with dramatic warnings. There is not always unbearable pain before it happens. Sometimes there is simply a collapse, a fatal irregular heartbeat, a loss of consciousness in seconds. And what I hear most often is this: "Doctor, he was just getting up, like every other morning." That is exactly the problem. After age 60, the arteries are stiffer. The system that regulates blood pressure is slower. Blood can be thicker when you wake up. The heart has less room for error. And yet millions of people begin their day as if they were still 30 years old. In the next few minutes, you are going to learn what specific action is linked to the highest number of morning cardiac events. You will learn why the heart is most vulnerable right after waking. You will discover the 7 silent warning signs that may mean you are already at risk right now. You will understand the hidden factors that increase danger without you even knowing. And you will get the exact morning protocol I recommend to older adults to protect their heart every single day. I am not here to scare you. I am here so that tomorrow, when your alarm goes off, you make a different choice. Because prevention is not dramatic. It is quiet. And many times, it comes down to just 15 minutes. Now let us get into the part nobody ever explains to you. The activity linked to the highest number of sudden cardiac events in older adults is not running a marathon. It is not lifting heavy weights. It is not extreme exercise. It is something far more everyday. It is getting up too fast from bed and starting the day with immediate physical effort in the first few minutes after waking up. Let me be even more specific. Jumping out of bed the moment your alarm rings. Getting up quickly to go to the bathroom. Straining hard during a bowel movement in the first minutes of the day. Climbing stairs right after waking. Bending down suddenly. Stepping into a very hot or very cold shower immediately. Carrying heavy objects before your body has had time to stabilize. Many older adults do these things every single day and have never had a problem. And I want to be honest with you here. This does not mean that every time you get up quickly, you will have a heart attack. It means that every time you do it, you are pushing a system that no longer has the same ability to adapt. And when other hidden factors are also present, the risk multiplies. Let me explain what is happening in your body during those first 5 minutes. While you sleep, your blood pressure naturally drops. Your heart rate slows. Your metabolism quiets down. Your body enters a state of deep rest. But just before you wake up, your brain begins activating the sympathetic nervous system. Cortisol is released. Adrenaline is released. Noradrenaline is released. These hormones raise blood pressure and increase heart rate to prepare you for the day. This is called the morning awakening response. In young, healthy adults, the cardiovascular system responds elastically and efficiently. But after 60, the arteries lose flexibility. Cholesterol plaques may be partially narrowing the coronary arteries. The system that regulates blood pressure responds more slowly. The electrical system of the heart can be more unstable. Now imagine this. Your blood pressure is already rising naturally from the hormonal surge. And at that exact moment, you get up suddenly. When you do, gravity pulls blood down into your legs. The heart has to pump harder to compensate. Blood pressure may spike even higher, or in some cases, it may drop sharply before bouncing back. That sudden drop can cause orthostatic hypotension, hypertensive spikes, electrical imbalance in the heart, and a brief reduction in blood flow to the coronary arteries. And if at that same moment you also strain, for example during a bowel movement, the increased pressure inside your chest can further disrupt blood flow to the heart. That is a dangerous combination. Multiple studies have found that a significant percentage of serious cardiac events occur during apparently simple activities, like getting up, using the bathroom, or doing light physical effort in the morning. Now, how do you know if your body is already showing signs of cardiovascular fragility? This is where we get into something truly essential, because the heart almost always gives warnings. The problem is that many people do not recognize those signs. In a moment, I am going to explain the 7 warning signs you should never ignore, especially if they happen in the morning. But before I continue, I want you to do something important. If this information is helping you better understand your body, subscribe and hit the like button. We do not do sensationalism here. We talk about real prevention. Now let us go through the signs that may mean your heart needs attention. The first warning sign is dizziness when you get up. I want you to be completely honest with yourself. Have you ever stood up and felt the room spin for a few seconds? Have you had to grab a wall or a table because you felt like you might fall? Many older adults tell me, "Doctor, that is just normal. It is just age." No, it is common, but it is not normal. When you stand up, your cardiovascular system must quickly compensate for the change in position. Blood tends to fall toward your legs because of gravity. The heart must slightly increase its rate. The blood vessels must contract to maintain adequate pressure to the brain. If that mechanism is slow or insufficient, there is a temporary drop in blood pressure. That is called orthostatic hypotension. And it is not just a simple dizzy spell. It is a signal that the cardiovascular regulation system is compromised. In older adults, this condition is associated with a higher risk of falls, fractures, and also a higher risk of cardiac events and strokes, because it indicates the vascular system is no longer responding as efficiently as it should. If you experience frequent dizziness when getting up, especially in the morning, your heart and blood vessels may be under more stress than you realize. The second warning sign is chest discomfort in the morning. It is not always intense pain. Sometimes it is a mild pressure, a brief sensation of tightness, a slight discomfort that disappears in minutes. And many people minimize it. "I probably just slept wrong. It is a muscle cramp. It is gas." Maybe, but it could also be morning angina. During the first hours of the day, the heart needs more oxygen due to the natural rise in pressure and heart rate. If there is a partial blockage in the coronary arteries, that increased demand can create a feeling of pressure or discomfort. The dangerous part is that it often lasts only a few seconds and then disappears. But the fact that it goes away does not mean an episode of transient ischemia did not occur. And when these episodes repeat, the risk grows. If you have felt chest discomfort upon waking, even mild discomfort, it deserves evaluation. The third warning sign is heart palpitations when you wake up. This is one of the most ignored signs. Fast beats, irregular beats, a feeling like your heart is jumping or pounding hard for a few seconds. Many older adults assume it is anxiety or nerves. But during the transition from sleep to waking, the electrical system of the heart is especially sensitive. The surge of adrenaline can trigger arrhythmias in hearts that are already predisposed. And I want you to listen very carefully to this. In multiple cases of sudden cardiac death, weeks before the fatal event, the person had been experiencing occasional palpitations and never sought help. Not all palpitations are dangerous, but palpitations that appear frequently upon waking, especially when combined with dizziness or weakness, need medical evaluation. The fourth warning sign is shortness of breath with minimal activity. If you feel like you need to stop and catch your breath just walking to the bathroom. If climbing a few stairs leaves you exhausted. If you wake up feeling chest tightness or difficulty breathing, your heart may not be pumping with the efficiency it needs. Early heart failure often shows up as mild shortness of breath that people attribute to getting older. But aging should not stop you from walking inside your own home without running out of air. Morning breathlessness can indicate that the heart is struggling to manage blood volume after the change in position and the hormonal activation. And that is a sign that deserves attention. The fifth warning sign is cold sweats or unexplained nausea. Many people describe a strange feeling before a cardiac event. It is not intense pain. It is a sense that something is not right. A sudden cold sweat, nausea with no obvious cause, an inner restlessness that is hard to explain. The autonomic nervous system can activate abnormally when the heart is under stress. If you experience these symptoms in the morning, especially combined with chest pressure or weakness, do not ignore them. The sixth warning sign is extreme fatigue upon waking. I am not talking about sleepiness. I am talking about deep exhaustion. If you sleep 7 or 8 hours and wake up feeling like you have not rested at all, if you feel disproportionate weakness with minimal effort, there may be an underlying cardiovascular condition. A heart that is not pumping efficiently reduces oxygen delivery to the tissues. That creates persistent fatigue, and it is often one of the very first signals. The seventh warning sign is swelling in the legs or ankles. If your shoes feel tighter by the afternoon, if you see indentations from your socks when you take them off, if your ankles look swollen frequently, there may be fluid or tension associated with a heart that is not managing venous to return adequately. Gravity accumulates fluid in the lower extremities when pumping is insufficient. And while swelling does not always mean a cardiac problem, when it combines with other signs, it is an important indicator. Now, I want you to ask yourself a very direct question. Did you recognize any of these signs in yourself? If the answer is yes, do not panic, but do not ignore it either. In the next section, I am going to explain 5 hidden factors that increase morning risk, even if you have no obvious symptoms, and some of them may be present without you knowing. The first hidden risk factor is morning blood pressure spikes. Your blood pressure is not a fixed number. It changes throughout the day following a natural biological rhythm. During the night, it normally drops. But upon waking, something called the morning hypertensive response occurs. Blood pressure can rise rapidly in the first minutes of the day due to the release of cortisol and adrenaline. In young people with flexible blood vessels, that increase is controlled. But in older adults with high blood pressure, stiff arteries, or cholesterol plaques, that spike can be much higher and much more dangerous. The problem is that most people measure their blood pressure in the afternoon, after the spike has already passed, and they believe everything is under control. But they do not know what is happening between 6 and 8 in the morning. I have had patients with normal blood pressure readings at their doctor's office in cities like Chicago and Houston. But when we monitored them over 24 hours, we discovered severe morning spikes. And if at that moment the person gets up suddenly and makes an effort, the risk increases dramatically. That is why I strongly recommend, especially after 60, measuring your blood pressure on several mornings, right after waking, before getting out of bed. That information can tell you far more than a single reading at the clinic. The second hidden risk factor is overnight dehydration. You spend 7 to 8 hours without drinking any water. That means when you wake up, you are slightly dehydrated. It may seem minor, but physiologically it is not. Your blood becomes slightly thicker. That means it circulates with more difficulty and can favor clot formation in people who are already predisposed. Additionally, the effective blood volume decreases slightly, which can affect blood pressure regulation when you stand up. When you get up suddenly while dehydrated, your system must work harder to compensate, and your heart pays that price. That is why something as simple as drinking a glass of water before you get out of bed can make a significant difference. This is not a trend. It is basic physiology. The third hidden risk factor is undiagnosed sleep apnea. This is more common than you might think. If you snore loudly, if your partner tells you that you stop breathing in your sleep, if you wake up gasping or with a headache, you may have sleep apnea. During apnea episodes, oxygen in the blood drops. The heart has to work harder. Blood pressure rises repeatedly throughout the night. That means when you wake up, your cardiovascular system is already under stress. And if you then get up abruptly, the risk multiplies. Many older adults in places like Florida, Arizona, and across the country live years with sleep apnea without knowing it. And it is one of the factors that most increases the risk of morning arrhythmias. The fourth hidden risk factor is chronic constipation. I want to talk about something almost nobody mentions, but that is very relevant. The intense straining during a bowel movement. When you strain hard and sustained, something called the Valsalva maneuver occurs. Pressure inside the chest increases. Venous return to the heart temporarily decreases. Then, When the straining is released, there can be a sudden rebound in blood pressure. In a vulnerable heart, that sudden shift can trigger an event. Many cardiac episodes in older adults have occurred in the bathroom, and it is not a coincidence. If you suffer from frequent constipation, do not normalize it. Treat it. Increase fiber, hydration, and gentle movement. And if needed, speak with your doctor about the right treatment. The fifth hidden risk factor is incorrect medication timing. Some blood pressure medications reach their peak effect several hours after being taken. If you take them in the morning, but your blood pressure spike occurs before the medication kicks in, you are unprotected during your most vulnerable moment. Every case is different. Do not change your medication on your own, but do have a conversation with your doctor about what timing best covers those critical early morning hours. Now I want you to pause for a moment. Not every older adult has all 5 of these factors, but many have at least one. And when combined with getting up suddenly and making immediate effort, the risk increases significantly. The good news is this: every single one of these factors is manageable. And now we come to the most important part of this entire video: the step-by-step morning protocol that can protect your heart every day. A simple, practical protocol, one that takes only about 15 minutes, and that can significantly reduce your morning cardiovascular risk. The first step of the protocol is a gradual awakening. When your alarm goes off, do not jump out of bed. I know many people do it out of habit, but your heart does not need to be rushed. Turn off the alarm calmly. Stay lying down for at least 30 additional seconds. Take 5 deep breaths. Inhale for 4 seconds. Hold for 1 second. Exhale for 6 seconds. That simple breathing pattern reduces the excessive activation of the sympathetic nervous system. Then gently move your fingers and toes. Slowly turn your head from side to side. Gently flex your ankles. This signals to your body that it is transitioning from rest to movement, without any abruptness. This first step may seem small, but physiologically, it is enormous. You give your blood pressure time to rise gradually instead of spiking suddenly. You give your heart time to adapt, and you give your brain time to coordinate the transition. The second step of the protocol is immediate hydration. Before you get up, drink a glass of water, ideally between 7 and 10 ounces. That is why I always recommend leaving a glass prepared on your nightstand the evening before. Water begins improving your circulating blood volume almost immediately. It reduces blood thickness. It helps stabilize blood pressure, and it prepares your cardiovascular system for the change in position. If you have medications your doctor prescribed to be taken on an empty stomach, this is a good time to take them, as long as they were prescribed for this schedule. Never change anything without medical guidance, but do take this moment to hydrate. The third step of the protocol is sitting on the edge of the bed. Now slowly roll to your side. Use your arms to gently push yourself up until you are sitting on the edge of the bed. And here comes a key part. Do not stand up yet. Stay seated for at least 2 to 3 full minutes with your feet resting flat on the floor. Breathe normally. Rotate your ankles in small circles. Gently flex your knees. This time allows your cardiovascular system to make the necessary postural adjustment. If you stand too quickly, blood can drop suddenly into your legs and cause dizziness or a drop in blood pressure. But if you remain seated for those minutes, the body compensates gradually. I have had patients who simply by adding this one step completely eliminated their morning dizziness. The fourth step of the protocol is standing up in stages. After those seated minutes, stand up slowly. Hold onto the bed frame or a stable piece of furniture. Once you are on your feet, do not walk immediately. Stay still for about 30 seconds. Check in with how you feel. Is there dizziness, weakness, palpitations? If everything feels stable, begin walking slowly. If you feel something unusual, sit back down and wait a little longer. This step dramatically reduces the risk of orthostatic hypotension and prevents sudden blood pressure spikes. The fifth step of the protocol is low-effort activities during the first 30 minutes. This point is essential. During the first 30 minutes after getting up, do not carry heavy objects. Do not climb stairs quickly. Do not do intense exercise. Do not take extremely hot or cold showers. Do not strain hard during a bowel movement. Walk slowly. Wash your face with warm water. Make your breakfast without rushing. Let your body complete its physiological transition. Remember, most cardiac events occur within the first hour of the day. Reducing intensity during that window can make all the difference. The sixth step of the protocol is a normal breakfast and routine. After 30 to 60 minutes of gentle activity, your cardiovascular system is stabilized. At that point, you can eat breakfast calmly, take the medications that need to be taken with food, and continue with your normal day. The total time for this protocol is approximately 10 to 15 extra minutes. Just 15 minutes. Think about what that could mean for your health. Now let me share something with you. One of my patients, a 72-year-old man from Tennessee, had been experiencing frequent dizziness when getting up every morning. He had never thought much of it. He just assumed it was age. I taught him this protocol. 2 weeks later, he came back and said, "Doctor, I feel like my body wakes up more peacefully now." That is not magic. That is physiology being respected. Now I need you to pay very close attention, because even if you do everything right, even if you follow this protocol, even if you take care of your blood pressure, your diet, and your sleep, nobody has zero risk. And knowing how to act in an emergency can be the difference between life and death. If at any moment, especially in the morning, you experience any of these symptoms, act immediately. Pain, pressure, or tightness in the center of your chest that lasts more than a few minutes or that comes and goes. Pain that spreads to your left arm, both arms, your jaw, your neck, your back, or the upper part of your stomach. Intense shortness of breath, sudden cold sweat, nausea with no clear cause, extreme dizziness, violent palpitations with a feeling that you might faint. Do not wait. Do not lie down to see if it passes. Do not take a painkiller thinking it might be a muscle issue. Act immediately. First, sit down or lie down right away. Do not remain standing. Reducing effort lowers the burden on the heart. Second, call 911 immediately. If you are alone, call yourself. If someone is with you, have them call while you stay seated or lying down. When the operator answers, say clearly, "I think I am having a heart attack." Then give your exact address. Do not minimize your symptoms. Time is heart muscle. Every minute without treatment means more damage to the heart tissue. Third, if you have low-dose aspirin at home, chew one tablet if you have no known medical contraindication. Do not swallow it whole. Chew it. That way it is absorbed faster. Fourth, loosen any tight clothing. Stay as calm as possible. Breathe slowly and deeply. If you have nitroglycerin prescribed by your doctor, use it exactly as instructed. And something very important, do not drive yourself to the hospital. It is dangerous. Wait for the ambulance. Emergency personnel can begin treatment on the way. Many patients survive because they acted quickly. Others did not have that chance because they waited too long. Now let me ask you a very direct question. If tomorrow morning at 7 a.m. you felt an unusual pressure in your chest, would you know exactly what to do? Starting right now, you do. If this video helped you understand something you did not know before, subscribe and like the video. Share this information with your parents, your friends, your neighbors who are over 60. Because many tragedies do not happen from total ignorance. They happen from small details that nobody explained in time. I am Dr. Adrian Cole. Take care of your heart every morning. I will see you in the next video.